Hello, in this presentation, we're going to be talking about dental photography, and we're going to be using the American Academy of Cosmetic Dentistry guidelines. The American Academy of Cosmetic Dentistry recommends taking 12 photographs for cosmetic or restorative cases. And these are the portrait, the close-up smile, the close-up right and left side, the retracted smile, the retracted right side, retracted left side. We take and this is an important picture for cosmetic purposes, a picture of the upper arch using a contraster or a black background, intraoral background. And we use the same background to take the right close-up and the left close-up. And last, we take the occlusal views of the upper and the lower arch, which you are familiar with from taking orthodontic or Invisalign records. So this is the difference between the 12 photographs that we take for restoration purposes versus the 8 photographs that we typically take for orthodontic purposes. Now, when do we take the 12 AACD pictures, or the American Academy of Cosmetic Dentistry photo series? Typically when the patient needs major restorative treatment, when they need a full arch reconstruction or full mouth reconstruction, when we have all on X cases, which means that patients need large bridge restorations or dentures that are anchored by 3 or more implants, when people are looking to do cosmetic cases like anterior restorations, whether that's composites or veneers, when people are looking to do smile makeovers, patients that have very badly worn dentition, or people who have their teeth in like really bad shape, and we're going to have to be discussing at least a couple of different alternatives. For the purpose of these types of consultations, typically we can't really cover all that information in one 10 to 15-minute consultation. We're going to have to bring the patient back, and that's when we use the pictures so that we can gather documentation, so that we can come up with a good treatment plan and have a treatment presentation ready for the second consultation. Now, why do we take the photos? First of all, is for patient education. Most people don't really know what their teeth look like from different angles, and you're going to find that a lot of them are surprised when they see what's happening with their teeth in the back or behind the teeth. Obviously, we use those for case presentation because it's a good way to define expectations on the patient. What is it that we can do and what is it that we can't do? And we can discuss different reasons why with the patient. We can also use it as legal documentation because when we work on patients, sometimes if there are issues with either the restorations that we've done, or because sometimes there are cases that involve reconstructing teeth that have been damaged by accidents or work injuries. So we can use them for legal documentation for these purposes. For treatment planning, because we can, like I said, we can use it to formulate at least a couple of different alternatives for patients to be able to visualize what is it that we could potentially do for them, and we can communicate those options with them. And one of the main purposes is for communication with the laboratory. These photographs we're going to be using so that the laboratory understands what the patient's teeth look like, their smile, the soft tissues, and get a better idea of what the potential outcome could be. And also these days we're using it a lot for artificial intelligence simulation, so we can show the patient potential outcome of their the restorative dental work or cosmetic enhancements. What are the things that we need to take these pictures? We need at least a basic smartphone with a decent camera that has good definition, whether that's Apple or Android. Ideally, we want to use a professional DSLR camera, and there's a lot of them that we can use for this purpose. But the very basic thing that we can use is a phone, a smartphone. We can use a twin flash that has it has some diffusers, so there's not a lot of reflections coming up in the pictures. A good set of intraoral mirrors is important. These are the black intraoral contrast that we can use to take those um, pictures that need black backgrounds. I included a bowl with warm water, and that's so that we can soak the mirrors in there to, warmer mirrors don't fog that easy. So typically we have a bowl with warm water to keep the mirrors in before we put them in the mouth so they don't get fogged up when the patient breathes. And also we need a set of good retractors. I recommend the deep notch cheek retractors so that we can capture more of the posterior part of the teeth. These are some basic guidelines that we can use to take these pictures. We want the patient to be standing away from the wall, like about 6 to 12 inches from the wall, and ideally a lighter color background. You want to make sure that you position the phone vertically, parallel to the axis of the patient, the axis of the standing patient. If the patient is taller or shorter than you are, you want to make sure that you raise or lower your arms so that the phone or the camera is at the same level of the patient's eyesight. And we're going to frame the face of the patient so that there's a little bit of background on top of the head, about 3 to 6 inches, and then about 6 inches below the chin, or like to show a little bit of the neck and a little bit of the upper part of the shoulders. Make sure that the camera is centered. You can use the tip of the nose as the center of the frame. And once you make sure that the face is in focus and there's not weird lighting on it, then you can actually take the snapshot. This is roughly what the first picture is going to look like, and that's what we call the smiling portrait or the front face picture. And then from that, we can either crop the second picture that we need for the series, which is the smile close-up or the nose to chin, how we call it. And you can do it by cropping it, or you can actually get a little closer or zoom in so that we can get a better definition. I would prefer if we can zoom in than having to crop it from the first picture. We're also gonna be doing the close-up of the, it's not a side picture, it's like a 3/4 profile of the nose to chin. It's a close-up of the smile. And we're going to be doing both right and left side. And we start going into the intraoral pictures. For that, we're going to be using the retractors, and we're going to be taking a close-up photograph of the retracted smile. And when we set it up, when we crop it, we want to make sure that we correct any rotations or angulations of the picture so it doesn't look slanted. We want to crop it so we can minimize the amount of skin that is showing. We just want to see the teeth and then some of the gum tissue. I want to try to be able to see as far back as we can, framing it so we can see both sides. Then we're also going to take the deep, and these are the same pictures that we take for ortho purposes, the deep notch right side pictures. And same thing, we crop it so that we don't see a lot of the skin. And then we do the same thing for the left side. And this is where things start getting a little interesting. This is what we start taking for cosmetic purposes. We start using the contraster or the black intraoral background. We use retractors and we put the contrast so that we can take that picture of the upper arch and we can capture those little details of the contours of the teeth, the edges, the translucency of the enamel, and the appearance of the different shades of the teeth. And you can actually try to do this in different lightings. I typically prefer to have a medium intensity on the light, so it's not too bright. But you can try different brightness to capture different features of the teeth. One of the most important things with this picture is obviously to make sure that the midline is centered in the middle of the frame, and that the camera is angled completely perpendicular to the occlusal plane or to the bite, so that we can see as much as we can from the back teeth. The next one is going to be a side view. We're still going to be using the same contraster, but we're going to be doing a close-up of the right side and a close-up of the left side. And that's so that we can capture the lateral teeth, the canine, have like a more straight-up view of those teeth. And the last ones that are going to be a little tricky are the occlusal view of the upper and the lower arch. These pictures are a little bit more technique sensitive. It requires sometimes the help of a second assistant or the doctor and one assistant so that we can get proper retraction, proper positioning of the mirror. It is recommended that the mirror is sitting at a 45-degree angle from the bite plane. That's easier said than done because not everybody's able to open that big. And we want to make sure that the back edge of the mirror is reaching as far back as possible so we can capture the last molars. And that's obviously if the patient is able to tolerate having a mirror all the way back close to the palate. Also, we want to make sure that the camera is angled at a 45-degree angle with the mirror so we can get a good picture of that occlusal view. And then after we do that, we want to do the same for the lower one. We position the mirror at a 45-degree angle and we tip it so that it's contacting the edges of the upper front teeth so that we can try to create that angle. The patient has to open really big, and it would be ideal for the patient to help retract. And we don't want to retract to the sides. We want to retract to the sides, but towards the lower so we can expose the lower anterior. Sometimes one of the biggest mistakes that we see in this picture is that we get retraction on the sides, but the lower anterior edges of the front teeth are covered by the lips or the soft tissue. So we want to make sure that we get the retractors positioned in a way that is going to expose the incisal edges of the front teeth, and we try to capture all of the teeth the way it looks right here. When we put these pictures together, because they are taken in mirrors, we want to make sure that we rotate the pictures because this is a reflection of what the arch looks like. So we have to flip them horizontally and we have to flip them vertically, correct any rotation of the picture, and then we can crop it so we can minimize the soft tissue that is showing in the picture. So those are the 12 pictures that we take for restorative cases. There's going to be a different presentation on the photographs for orthodontic purposes, but these are the pictures that you have to take and get really familiar with that series, the 12 pictures, so that whenever we have cases that require cosmetics or restorative cases, make sure that you get all of your supplies ready and take all the pictures and learn how to put them together in a file or in a format where you can see them all in a single view. And that's it for now. I'll see you in the next video.